Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-year cancer survivor on Amazon. I want to continue on with my talks on particular specialists for long term survivors. And this one's important if you have received radiation therapy to the upper part of your body, at least. Definitely including the neck area and head area. Um, we sometimes nickname radiation as the gift that keeps on giving. So, even though radiation, when it's used properly, is quite successful at treating cancers, unfortunately, the radiation keeps working after you're done being treated, and it keeps working for a long time. And unfortunately, unless you're being watched, um, it works behind the scenes. You go about your daily normal life for years at a time without being aware of what might be happening. And again, I want to stress not necessarily guaranteed. Okay. I'm not a doctor. I'm simply relating my experience with what happened to me. I was treated with radiation in 1989 for Hodgkin's lymphoma, upper mantle, which basically meant from my jaw down to my abdomen and from shoulder to shoulder. Okay, so I got through my 5 years and got discharged by my oncologist, never to see him again, and nobody really paying attention because there wasn't any need to. I was being watched for 5 years to make sure my Hodgkin's didn't come back. It didn't, so there's nothing to worry about. Fast forward to 2008 when I had to have emergency heart surgery for a widowmaker heart blockage, also caused by my radiation. That'll be a different video. But it was at that point that I realized that I was suffering late side effects from my Hodgkin's treatments, both radiation and chemotherapy. One of the studies that was ordered on me was a carotid artery ultrasound. And what that discovered was that there was a minimal blockage in my left carotid. Now, because surgery on cancer survivors is risky, it became a situation where we take that baseline ultrasound, which shows the blockage, and we're going to do another ultrasound maybe in a couple years so we can compare it to see if there is any more increase in the blockage. Spoiler alert, there was. So those ultrasounds became more frequent and the blockage became worse. Now, you would wonder why not just fix it? Again, the risk of fixing this type of blockage is also to risk causing a stroke. So the philosophy became they had to wait until the risk of doing nothing became worse than the risk of doing something. In other words, like a ticking time bomb. Okay, so I went many years. It went from 19. I went from 1990 until about 2009 when this was discovered, and then in 2021 I had a procedure called a TCAR, TCAR, and I do need to reference this so that I am accurate with it. It stands for transcarotid artery revascularization, TCAR, TCAR. And what that is that's a minimally invasive procedure. And it's one that they do to reduce the risk of causing a stroke during the procedure. My fellow long term survivors who were treated years before me when they had their carotid artery blocked to the point that it needed to be repaired, many suffered strokes. Some developed other issues, had a heart attack during the process and stuff like that. It was really a risky procedure. What this TCAR does is not only do they go into the carotid artery to place a stent, um, what they do is they divert the blood through another tube into the leg. And I want to. My brain is a little foggy with exactly, so I apologize for stuttering with this. The idea was to take the blood flow that was going up to my brain, divert it down into my leg. In the event that any of this calcified, plaquified, whatever, would break away during the process of putting the stent in, it wouldn't go up to my brain, which ultimately would cause a stroke, and that would be a really bad thing. It wasn't a long procedure to go through. I was out, I believe, for about an hour. And when out, I mean in twilight. I wasn't totally anesthetized. They want to keep you alert to make sure or awake enough that they can talk to you and you can answer them because they're obviously watching for a stroke. I was kept overnight and sent home the next day. So that was a very good procedure. Now I am followed up on this one, my left one, every year to make sure that the stent is holding properly. These stents are considered medicated, so they have a life expectancy of somewhere 7 to 10 years. So this was done in 2021. I expect this to start showing signs of needing repair again in a couple of years. In the meantime, they are watching my right carotid, which compared to other ultrasounds is also showing an increase in blockage there. But again, not likely that they would do any intervention on that until it became more serious. So I see a cardiovascular specialist every year who orders an ultrasound on my carotids every year to compare my prior ultrasounds to watch for the progress of any blockages. This is why it's important, okay, to start with that primary care doctor that I told you about, to coordinate and organize and support all these other specialists that I have to deal with. My primary care is aware of this condition and leaves everything up to the cardiovascular doctor to do. But it started with the primary care doctor ordering that initial carotid ultrasound. And so if you've had radiation, and again, if you're dealing with radiation being used today, they're using a lot less, so the chances of developing these issues is also reduced, not eliminated. Okay, so after your 5 years and you're done with your oncologist, see your primary care doctor and make sure if you had radiation, especially in this area of your body, make sure that you get those carotid arteries checked. And at the least, you're going to have a baseline that maybe 5, 6 years later, you need to get it checked again, and you have something to compare it to if those carotid arteries have gotten worse. Again, this is my point behind Paul's Heart. I'm not a doctor, and I realize that not everybody is being told about these potential late side effects. Again, not guaranteed, but possible. And the fact of the matter is, cancer patients need to be told to look out for this stuff. You have no way of knowing if you're going to develop these side effects or not, and therefore you need a doctor to look out for them. If they don't find any, great, you get that good news right away. If something comes up, it can be dealt with before it becomes something serious or worse. So until then, this is Paul's Heart. This is what I'm about. Share this post, share my page. You can find me on YouTube at Paul's Heart. You can find my webpage where I have plenty of links to other information pertaining to survivorship issues at paulsheart.com. Until next time, this is Paul's Heart.